Another pathology we encounter quite frequently are renal cysts. They are usually benign lesions, contain serous fluid, and are lined by a thin wall of epithelium. About 1/3 of people older than 50 years can develop renal cysts. Most of them are simple cysts. It is important to distinguish simple, harmless cysts from complicated cysts, because in these cases there is a risk of malignancy and we need further investigation. Most of simple cysts are usually clinically silent, and in rare cases there can occur hemorrhage and acute pain. But there are also polycystic kidney diseases, and they can have different symptoms varying with the underlying disease. In ultrasounds, renal cysts contain fluid, and so they are echo-free. They show posterior acoustic enhancement and lateral wall shadowing, which can help us in our diagnosis. They are usually of round or oval shape and have sharp, thin posterior walls. Now we can easily detect this round echo-free area over here. A simple renal cyst, we've got sharp, thin walls and also acoustic enhancement over here. You can see the ultrasound beam is brighter, the ultrasound picture is brighter over here, behind the cyst. Also in the next picture, again a simple cyst of the kidney, echo-free in the middle, more oval-shaped and sharp, thin walls with dorsal acoustic enhancement. This is a cyst of the caudal renal pole, a parenchymal cyst. Again, all criteria for cysts are fulfilled. Here we got a video clip of the right kidney, and we can easily detect this cystic structure over here. A simple renal cyst. Again, echo-free, sharp, thin walls, and dorsal acoustic enhancement. Next video shows something different. We got also renal cysts, but a lot of them. This is a polycystic kidney, and we can see we have some simple cysts, but also so-called complicated cysts. They are not totally echo-free and have septations. And not every one of them has sharp, thin walls. We see calcifications. And in this case, we need further investigation. Here, another video of the same patient, renal pelvis in the middle, and we can see this patient has many renal cysts in the parenchyma and also in the renal pelvis. So complicated renal cysts are often not totally echo-free. They got septations or calcifications. Sometimes we cannot display the dorsal acoustic enhancement, and we can find echogenic structures inside the cysts. Sometimes we can see wall thickening or irregularities, and the borders are often not really defined. The most important thing is that complicated renal cysts need further diagnostics. And the most important differential diagnosis is the cystal renal cell carcinoma. So as a conclusion, we keep in mind the criteria for simple cysts. They are echo-free, round or oval shaped. They got clear, sharp borders. We can find posterior acoustic enhancement and often lateral wall shadowing. And complicated cysts need further diagnostics because there is a risk for malignancy. Our next chapter will be the degenerative changes of the kidneys, the atrophic kidney. Apparent degenerative changes of the kidney frequently occur in chronic kidney diseases, which occur worldwide, especially in elderly people. The underlying cause can be, for example, hypertension, cystic kidney disease, or diabetes-induced kidney diseases. In an atrophic kidney, we see a loss of renal parenchyma that leads to decreased size of the kidney and also to loss of function. And one or both kidneys can be affected. Quite frequently, the patients have no symptoms at all. In advanced cases, we can see all signs of chronic kidney disease. But often the only sign is an elevation of renal function parameters in the blood tests. The ultrasound features of an atrophic kidney are a loss of parenchyma that leads to a smaller size, and also the parenchyma-pillar index is reduced. Also, the borders are often not easily defined, and sometimes we can't even easily detect the kidneys because of the reduced size. Now let's see what it looks like in ultrasound. It's easier here in this image because we've got the two marks, and in between we find this atrophic kidney, but you can see that the renal pelvis has a normal size, but the parenchyma is really very small. And also the borders are not easy to define anymore. This is an atrophic kidney. Same at the next image. You can imagine that it's not so easy to detect this kidney because it's got a reduced size, the hypoechoic parenchyma is very small, and we just see a little bit of parenchyma around the renal pelvis. In this chapter, we will show to you two common renal tumors, the angiomyolipoma, which we will encounter quite frequently, and the renal cell carcinoma, which is the most frequent malign renal mass. The last point of this chapter will be a pseudotumor, the so-called dromedary hump. We start with a usually benign tumor, the renal angiomyolipoma. The renal angiomyolipoma is a perivascular tumor and consists of blood vessels, smooth muscle cells, and lipoid tissue. The renal angiomyolipoma, as already said, is usually a benign tumor. Only a special variant of it, called the epithelioid angiomyolipoma, has a described risk of malignancy. The incidence varies from 0.3 to 3%, and it is more common in female patients. Renal angiomyolipoma is mostly an incidental finding. Patients are usually asymptomatic. There is a risk of spontaneous hemorrhage, though, which is increasing with the size of the lesion, especially when it's more than 4 centimeters in diameter. Sometimes patients can also present with a palpable abdominal mass, hematuria, or diffuse flank pain. Now, what does angiomyolipoma look like in ultrasound? We can see a round, strongly hyperechoic lesion. It can also cause acoustic shadowing. It's got clear borders and it's looking like a white ball. Mostly, it's located in the renal cortex. Important is that you should consider renal cell carcinoma when we've got atypical features. In this picture, we can easily detect this round, strongly hyperechoic lesion, which is typical for an angiomyolipoma of the left kidney in this case. A video clip. It's the same patient, the same lesion over here. Round, hyperechoic, a really wide lesion in the renal parenchyma. It's looking like a white ball. Here an image of a larger renal angiomyolipoma, also like you have thrown a white ball into the kidney. Here, the same lesion. In the video clip, typical features of a renal angiomyolipoma. In this case, the right kidney. This is another one. I want to show this to you because in this case, it's hyperechoic, well, but there's not clearly defined borders over here. We performed a CT in this case, and it was a normal angiomyolipoma with no signs of malignity, but just from the ultrasound picture, it was clear that this lesion needed further diagnostics. Now we proceed to a malignant tumor, to renal cell carcinoma. Renal cell carcinoma is originating from the tubular epithelium and is the most common type of renal cancer. About 90% of kidney cancer are renal cell carcinomas. And they also account for about 3% of malignancies in adult people. Like many malignancies, many patients are asymptomatic for a long time, especially as long as the tumor is still small. Possible symptoms due to renal cell carcinoma can be hematuria, flank pain, and a palpable flank mass. Hypertension can also occur, as well as weight loss and the presence of paraneoplastic syndromes. In ultrasound, renal cell carcinoma can be hyperechoic or hypoechoic, but it can also show up as isoechoic lesion. The structure of the lesion is mostly inhomogeneous, and sometimes we even find some cystic structures. And this can make us think of renal cysts first, but we find no clear, sharp borders. And often we can detect a so-called halo. We remember the hypoechoic circle around the lesion that can be a sign of malignancies. And it frequently exceeds the contour of the kidney. Contrast-enhanced ultrasound can be a great help for differentiation. In this image of the left kidney, you can easily detect a really large inhomogeneous mass over here, which also apparently blocks urine flow because the renal pelvis is dilated. This is highly suspect for renal cell carcinoma. In this picture, not so easy to distinguish, in the beginning here, the kidney, the parenchyma, the renal pelvis in the middle. This is also a Doppler signal. And this round lesion is protruding the renal border. Here's the normal renal border. And this big tumor is exceeding the renal capsule. Here, a video clip of the same lesion. It's easier to distinguish now. The kidney over here. Little bit dilated renal pelvis. And this protruding round tumor, in this case hyperechoic, but it's really exceeding the border of the kidney. Again, the same lesion, this time with the Doppler signal. You see there's blood flow in the lesion, round hyperechoic blood flow, and exceeding the renal border. Highly suspicious for a renal cell carcinoma. Our last pathology in this chapter of renal tumors is a pseudotumor. It's called the dromedary hump. The dromedary hump is a non-variant and is seated on the convex side of the left kidney. It's not a pathology, but it can be a relevant differential diagnosis to renal tumors. The dromedary hump is completely isoechoic to other renal parenchyma. There's no border, no halo. It really resembles the normal parenchymal tissue. In this picture, we can see a dromedary hump of the kidney, of the left kidney, of course, and we can see it's isoechoic to the renal parenchyma. There's got no borders, and it's just the same structure as the renal parenchyma. At the beginning of your ultrasound career, it can be difficult to distinguish it from real tumors. We advise you, if there's any doubt, initiate further diagnostics with a contrast-enhanced method. After completing this chapter, I'm sure you are able to find the most important pathologies of the kidneys.